Today we've been chatting to GPs about how we might build more health and well-being in our communities, recognising that those definitions probably need some looking into in terms of what we even mean by health and well-being. But we often focus so much on trying to prevent disease and kill disease, but we maybe haven't created environments that actually help communities to be well.
I'm Dr. Phil Hammond, and I'm an associate specialist in paediatrics. I was a GP for almost 30 years before that. I was starting off talking about the meaning of health. We spend trillions on healthcare globally, £124 billion in the NHS, but nobody's entirely sure what it means. And if we are going to service the nation's health, we need to have a better understanding of it. The traditional definition was an absence of disease and disability in a complete state of physical, mental and social well-being, which now seems completely inappropriate given that most of our patients are living with multiple long-term conditions. So I talked about health as being our fitness for purpose. It's up to individuals to decide what their purpose is, what they want to do with their one wild and precious life, and then we in healthcare try and make them fit for that purpose.
So how might we shift the game? How might we stop being so reactive, and how might we work more proactively with our communities? And so for me, that's about embracing a lot more humility, recognising there's a load of stuff that we don't know, and if we can actually sit and be with and listen to our communities differently, we can find whole new ways of working that actually really surprise us, but that enable new relationships to form, both between different organisations and teams, but actually with our communities themselves.
I think health is also your freedom to live a life that you have reason to value, that also values other people. It's your ability to make decisions that are free from nonsense. There's a load of nonsense out there, not just in politics, but in health as well. So we need to be able to make better choices. We need to be able to bounce back when bad stuff happens in our life, such as disease and disability. And we need to peacefully prepare for death. So I think those are the sort of core ingredients of health.
If we don't get the culture right in terms of how we work, we're on a hiding to nothing. So I particularly am passionate that we develop what I call the HIJK culture, and that we develop hope in our communities and in our teams, because there's a lot of reasons to not feel hope right now, and I think it's our responsibility to create an environment of hope that we really can change the future together. How can we be more inclusive in who we are involving in the conversation about health and well-being in the future and how we deliver healthcare? How can we build joy in our teams so that we actually enjoy the work we're doing? And how do we build more kindness together?
The pillars of health I call the clangers. So the clangers, based on obviously the children's colour TV programme in 1969, the clangers stand for connect, learn, be active, notice, give back, eat well, relax, sleep. And it's quite a good way of teaching lifestyle medicine to people. It's quite an easy template. And of all the clangers, I think social connection is probably the most important. We know isolation is as bad for you as 10 cigarettes a day. Rekindling communities, connecting communities, getting people to volunteer. Then learning is really important. I'd put money in schools before I put it in the NHS, because I think education is that important. Physical activity, more powerful than any drug. Noticing the world and taking time to relax and fill up your senses with the joy of the world around you. Giving back to others. Compassionate people are happier. Eating well, really important. Then relaxing and winding down and sleeping. All of those things can be taught, but they have to be revisited, because if you're living with debt or depression or domestic abuse or dementia, it's really hard to do. So clangers is a useful template. It's not easy, but I think it's really important we move away from over-medicalisation. So finally, my shirt says it all. There are too many pills and not enough people in the NHS.
Building a great culture is fine, and looking to work differently with people is fine, but it's got to be together with. It's got to be with our teams, it's got to be with our communities, and it's got to be together for the future. We can't do this alone, and if we try to, we're going to burn out. But if we take a step outside of our comfort zones and work differently with our communities, we'll find that we can have the kind of future that we really believe in together.